Hi ladies, this is a core workout. So it's a beginner's core workout. It's applicable to all new mums, but especially those of you who are trying to rehab a diastasis. The muscles which we will be targeting in this workout are your deep core muscles, so your pelvic floor, your diaphragm, your lower back muscles, but predominantly your transverse abdominal, or TA as I call it, your TA muscle. Your TA is like a giant corset or a pair of Spanx. It goes all the way around the midsection of your body, and its job is to stabilize your spine and pelvis ahead of movement. So before pregnancy, this was an unconscious muscle action. We didn't have to think about stabilizing your spine and pelvis before we did anything. All of the changes that happen during pregnancy mean that this muscle action needs to be relearned postpartum, which is where we all have difficulties, okay? So these exercises may look really simple, but if you're actually engaging the correct muscles to do the exercise, it's a different story, it's a lot more difficult, okay? So we're gonna start on our backs. And I'm gonna actually show you my tummy because it might help. Sorry, let's pull my hair out. So I'm gonna just roll this down. The section of your body that you're focusing on is this area, so just below your belly button, okay? So try and draw your awareness to this area while we're doing the workout. What we're gonna do to start with is just engage those TA muscles. So I want you to relax completely. Hands can be placed by the side, or sometimes it helps just to place them up by your temples because it draws your shoulders down a little bit. Okay, so we're going to take one big inhale. As you exhale, I want you to lift and engage your pelvic floor and imagine an imaginary zip which runs to the bottom of your ribs. You're going to pull it all tight. As you do this, your pelvis pulls into a neutral position, your ribs pull down. Okay, so this is what I call your braced position. So my spine's neutral, my pelvis is stable, my ribs are pulled down, my glutes are relaxed, my shoulders are relaxed, and this, apart from my hair bubble, is a relaxed posture. Okay, so breathe into that brace. Make sure you're not holding any tension anywhere else in your body before we start. Okay, you don't want your ribs to be flared out, your ribs are pulled down. Okay, let's crack on. So you're going to take an inhale. As you exhale, you're going to march to 90 degrees. Inhale, exhale. Inhale, exhale. Inhale, exhale. Now keep this going while I talk. You'll notice that my breath, especially the exhalation, I'm doing quite a long exhalation. You need your diaphragm to be engaged to get as much out of your core as you can. So really exhale as you pull your leg up towards the midsection. Now get your awareness to this part of your body and make sure that's doing the work. So you're not just using your leg muscles, because that would be really easy. Okay, so you're using your deep core muscles to draw your leg towards your body. All the way through, there's no tension anywhere else. My spine's stable and my pelvis is stable. Let's do 4 more together. Inhale. 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 And then at this point, you might just want to relax everything off. It sometimes helps just to draw your knees apart. It kind of relaxes your hip flexors a little bit. Give it all a little bit of shake, because you'll feel like you've kind of got a lot of tension in your body at this point, so shake it all off. And then we'll go on to the second exercise. So we always need to reconnect. You need to re-engage your transverse abdominal at this point. So again, exactly the same as before. Take an inhale. As you exhale, lift your pelvic floor, think about that zip. Pull your ribs down, spine goes into a neutral position. Pelvis is stable, spine stable, ribs are pulled down. This time, you're going to take 2 arms to extension above your head. and we're going to work alternate sides of your body. So we are going to inhale, exhale, inhale, so just guide your foot along the floor, exhale. You may find when you're doing this that your back wants to pull off the ground, so you might want to arch your spine. You're trying to work against that movement. Okay, so your spine's stable, your pelvis is stable. That's the most important thing to remember when you're doing this. Okay, really slowly use the breath. We'll do 3 more together. Inhale, exhale, inhale, exhale. One more time, guys. Inhale, exhale. Okay, again, relax it off, draw your knees to the side, breathe. And then I want you to repeat that on the second side. We'll aim for about 10-15 reps each side. And then the next exercise I want you to do is the bridge. So for this position, we still need to engage. So inhale, exhale, pelvic floor, zip, ribs are down, braces on. Inhale again. And this time as you exhale, you're going to lift into a bridge position. Now remember, you're not in yoga, we're not trying to do a back bend. Okay, your glutes are engaged, your zips on. Think about your pelvic floor, keep this area as active as you can. Okay, zip tight, shoulders relax, and just breathe in this position. So long inhale, and use your exhale to focus on your zip. Okay, long exhalation. Inhale. Remember, the exhale helps connect your core. If you're not breathing, you're not connecting your core properly. Long inhale. Long exhale. Let's do one more. Long inhale. Long exhale. Okay guys, slowly wind it down. Vertebrae by vertebrae, and again, knees pull out to the side. Take a few deep breaths, relax. Okay, next position, you're going to pull onto hands and knees. So for this position, this is a front-loaded position. So those of you who are working with a diastasis, just be more wary in this position. Obviously, gravity is going to be a key factor, so you need to really engage and pull as tight as you can. If you feel like you're doming at all in your stomach, then it's probably too much for you at this point. Hands stacked directly beneath your shoulders, knees are stacked directly beneath your hips. Give it all a shake to start with. Make sure your neck's in line, everything's relaxed. Take an inhale. And exactly the same as before, exhale. As you exhale, you engage your pelvic floor, you zip, you pull your core tight. Okay, your back's in a neutral position, your spine's stable, your pelvis is stable. You're going to do one more inhale. And as you exhale, you're going to use your core, so pull your belly button to your spine and float the knees 5 inches off the ground. Okay, take an inhale. Take a long exhale. Inhale. Exhale. Now try for 3 more deep breaths. Make sure while you're doing this that your pelvis doesn't pull into an anterior tilt like this, okay? So you want to keep your spine stable, your pelvis stable. Let's do 2 more breaths together. Inhale. Exhale. No movement in the spine. Inhale. Exhale. Okay guys, good work. Float down slowly and then just pull back to child's pose and release. Take 2 breaths in child's pose, and then I want you to repeat that 1 more time, so 5 breaths in that position. Okay, last exercise. You're going to be on your side body. Try and maybe use the lines. I have lines on my mat, which help aligning my body. So if you've got a line down the centre of your mat, that works quite well. Try and stack your knees, stack your pelvis, so your pelvis is lined up, your knees are lined up, your elbow and shoulder are aligned. Okay, again, we need to get this brace on, we need to activate the transverse abdominal muscles. So in this position, take a long inhale and exhale back into that zip. Okay, ribs are down, zips on, pelvic floor is active. Inhale. And as you exhale, use your side body to lift, 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 lift. As you do so, this zip does not release. Okay, arm goes up if you can, don't worry if you can't. Release any tension anywhere else, and as we've done all session, you're just going to breathe. Inhale. As you exhale, breathe into your zip. Inhale. Exhale. Now if you're feeling okay, you can work with the top leg up. Keep your top leg strong. 2 more breaths. Inhale. And force that exhale. 1 more time, guys. Inhale. Long exhale. And then you can relax. Okay, and of course you've got 2 sides of your waist, so you'll need to repeat that on the second side. Aim for 5 breaths each side. We're going to finish off the workout with a little bit of stretch. I can put my tummy away now. Okay, so it's always good to release the lower back muscles after you've been doing this. So just draw your knees in towards your chest, lift your head up towards your knees, give it a nice squeeze, and then draw back, take the head down. Your knees are going to go wide. Cactus out your hands, release your shoulders, draw your knees to one side. Sometimes it's quite nice just to draw your head in the opposite position, give your neck a nice long stretch. And again, breathe. Remember all the way through this workout, your breath is your core connector. So without your diaphragm working as it should do, if your diaphragm's just doing tiny little movements, you're not connecting your core. So long breaths all the time. When you've done one side, spin the knees across, take your head in the opposite direction, and again, breathe into your position, release the tension. Okay, and then we'll finish with one nice long stretch. Take a big sigh, and release it down. Okay, well done guys, and you're ready for the day.